And this is how we begin. Let's head straight to Accra's major children's healthcare facility, the Princess Marie Louis Children's Hospital, because there's a lot of frustration among parents, mothers especially there, following long delays to get healthcare for their sick children. There was chaos last night as frustrated parents of those children vented their anger at management of the facility for neglecting their duties. They tell JoyNews they are often compelled to spend the whole night and day at the hospital in desperate wait for a doctor to attend to their children. Here are some of them speaking to Adelaide Arthur.
When they like, they come. If they like, they don't come. Then you come. Since morning, I was here since 7:30. Look at me, I'm still here. What is that? Only one doctor. This one will come and leave before the another one will come. It's too much. It's too much. The children are suffering because of the children's health that they are here. They pay them, so they have to do the work wholeheartedly.
He is vomiting blood, and my mother called me from work to come and take him to the hospital. When we came this morning, there is no doctor here. We have been here since.
And what did they tell you?
Nothing. We are just sitting now. The doctor is one, and the people, you can see how many people are here. People, we are many. So it takes time to look after, and this is emergency. He needs to be taken care of.
How old is your child?
10 months.
I was told the doctor on night duty will attend to us at 8:30 p.m. But I told them I couldn't wait. But they assured me my children will be attended to. But I've been waiting since. My baby keeps crying, so I brought him to this hospital yesterday, and he was given medication. But his condition remains the same.
What the name him for? Now the name Kofi saying so almost say train kakra my doctor no show. So much madam.
I am taking my baby home. It doesn't look like I'll get to see the doctor tonight. And it's not safe to be out there at night with a baby.
For hospital for Frana.
The doctors don't care about seeing to patients who come to government hospitals. They are busy with their private practice, but they gladly receive payments from government. I have been here since morning on an empty stomach just to seek health care for my sick child. How will I be able to produce breast milk to feed my child?
Parents are angry, they are frustrated. They don't understand why only one doctor should be on duty in the afternoon and in the evening. They want authorities to do something about this situation. Adelaide Arthur, JoyNews, Children's Hospital, Accra.
That's a certainly frustrating situation, anything that will make any parent very angry. So JoyNews' Maxwell Agbagba was at the facility to engage hospital officials on this very worrying development. Dr. Isaac Aban, who is the acting medical superintendent of the facility, said they are working to increase the number of personnel who work on the night shift, as that was the cause of disagreement between the parent and some staff of the hospital.
Yesterday evening, I heard that there was somebody came here with a child, and he was seen at around 12:30, and I think asked to do labs and other things. But he claims he had spent so much time here, the waiting time, and he said there was only one prescriber since morning, which was not true, because in the morning we had 5 prescribers in all the consulting rooms. Normally we have most of them during the day, and then in the evening, by that evening we would have cleared most of the patients. So we don't normally have a lot of doctors in the evening. But yesterday we had one prescriber in the consulting room who was attending to the patients. So the nurses told them that was around 7:30 in the night when your reporter came. And even when the nurses had assured the patients to be to be patient, and that the doctor was going to see them. But unfortunately, they were not happy, and that's what happened yesterday. But I spoke to the person involved, and he seemed to have understood our situation. Sometimes we don't have a lot of prescribers, but we try our best. We try and do our best. And we're hoping that what happened yesterday will not occur again. We are having meetings to put things in place so that such a situation will not arise again.
Okay. Well, we've been here for some time, and we've been interacting with some of the mothers who've brought their children here. The issue that keeps coming up is the number of hours that they have to spend here. About 80 of them are outside right now, all waiting to get to the consulting room. What about the issue of personnel for this hospital? Do you have enough personnel?
At the moment, all the rooms, we have about 5 doctors all the consulting rooms have doctors at the moment as we speak this morning. I think normally if taking care of children is not like taking care, it's not the same as taking care of adults. The doctors have to take time to examine the children properly so that they can arrive at the right diagnosis and give the right treatment. The children cannot speak for themselves. The history has to be taken from the mother. So the doctor also relies a lot on his examination of the child to get an accurate picture. It's not necessarily taking all the history from the mother's history helps, yes, but he needs to properly examine the child to arrive at proper diagnosis. So definitely yes, some of them too have to go to lab. So when you have to ask to go to lab, of course you have to spend a bit of time here once the lab results. Also, even though the waiting time is a bit long, the children are also triaged. So the nurses pick out the very acutely ill, very seriously ill children from amongst them, and they jump the queue to see the doctor. And sometimes they explain to them, but sometimes some of them don't understand. They think they jump the queue, but it's because it's a children's hospital. We have to triage them and make sure the severely sick ones are seen first. So after that, then we can see the rest. So we do try to make sure, even though it's a long waiting time, but we'll make sure we don't miss any emergency. We're very particular about that.
So it's not an issue of the number of nurses or doctors available here. You don't have any problems with personnel?
Oh, yes, if we have more, we will be happy. But we are trying to make do with what we have at the moment. Yes.
Okay. So would you say
working hard?
So would you say you're fine with the number of nurses and doctors that you have here?
Oh, we can never say we have enough. If we get, the doctor is not only PM. A lot of hospitals also need doctors. There are not enough. Even the whole nation probably doesn't have enough doctors. But I think we are trying with what we have at the moment.
What about prescribers? Because from your explanation, what happened yesterday was because a prescriber was not around.
No, there was a prescriber around. Okay. Yesterday in the morning there were 5 prescribers. From morning till afternoon there were 5 prescribers. All the consults were run. It was only in the night that there was 1 prescriber. So normally by that time almost all the cases would have been seen. Most of them would have been seen. So they would normally have 1 prescriber at the OPD and 1 at the emergency units to take care of the cases, especially, and most of them might be emergency cases or seriously. So there was a prescriber on duty. There was one prescriber at night, and there was another one. So we had at least 2 prescribers on duty.
So after this incident, are you looking at increase in the number of prescribers who come on night duties?
Yes, we are taking a look at the timetable now, and the view of what happened. We're hopefully going to increase the number of prescribers at night to avert. So we are having a look and reorganizing our timetable, our duty roster to take care of the nights and to avoid such issues happening again.
Thank you very much.
Okay, you're welcome.
Maxwell Agbaba, they're getting a response from the authorities at the Princess Mary Louis Hospital over what happened last night. Well, if it looks like it's been solved, we'll find out from the Ghana Medical Association how best to deal with such situations.